Welcome to Teal Talk, a podcast brought to you by the Ohio Alliance to End Sexual Violence. That's OAESV for short. We're your hosts, Taylor
and Lori.
In each episode, we speak with professionals in the field to dive deep into the intersectional issues that affect survivors in Ohio.
Before we begin, we want to give a content warning that we will be discussing sexual violence and other issues that may be upsetting and triggering. If you need help, please feel free to call our resource line at 888-886-8388 during regular business hours, or the Ohio Sexual Violence Helpline 24/7 at 844-644-6435. Please take care of yourself. Hello, and welcome back to Teal Talk. I'm your host, Lori Hamami, Resource and Engagement Manager. Today, you won't be hearing from me and my typical co-host, Taylor Ucker-Lauderman. Instead, I'll be joined by Emily Gamar. You may remember her from our very first episode of the Teal Talk reboot in April of 2023. I can't believe it's already been 2 years since that episode. She discussed what public policy means for advocates and other people working in the anti-sexual violence field. And she spends so much of her time in and out of the State House connecting with legislators on issues impacting survivors. One of those legislators will actually be joining us on the podcast today. A fun fact is that her career started at her local rape crisis center, providing a unique perspective on advocacy at the State House. Welcome, Representative Michele Grim. I'm so excited to have you on this podcast.
Thank you for having me. I'm really excited to be on.
You've had quite the impressive journey from public health and crisis volunteer work to public office. Can you share a little bit about that journey and what first drew you to volunteering with rape crisis programs?
Sure. So before I was a state representative, I was on Toledo City Council for a year. And then before that, I worked in public health. And then before that, I was a rape crisis volunteer when I turned 18. So that was actually in my hometown of Ashland, Ohio. And how I got involved with that is in high school, we had to take a class called Career Seminar. It was just kind of explore different careers. One day we had a woman who came in. She had short purple hair. She had a thick Boston accent. And she was the founder and executive director of the local rape crisis center. And I knew her from a long time ago. Her son and my brother were friends in elementary school. And she's like, "Hey, Michele, do you remember me?" Her name was Jessica. Everybody was just kind of giggling because, here's this older woman with purple hair. And I was just like, that's what I want to do when I grow up. She was talking about what they do at the Rape Crisis Center. In this class, I go up to her and said, "Hey, how can I get involved?" And she's like, "Well, when do you turn 18? She's like, "You can be a rape crisis counselor." This was 25 years ago. So I turned 18 in May. There was a 40-hour training in July, and I took that training and I stuck with my local rape crisis center, even though I went away to school in Toledo and then moved away for a little bit for 10 years. And I did do a lot of the volunteer phone lines and that kind of thing. So that's kind of where my journey began in advocacy and public health. That kind of shaped my career trajectory. I did volunteer with the Sexual Assault Education and Prevention Program on University of Toledo's campus, and then I decided to get my master's in public health after my bachelor's of women's and gender studies. So that led me to public health and then working for various nonprofits and federally qualified health centers. Now with my work as an elected official, I get to still work on the things that I'm passionate about, especially around sexual assault, domestic violence, and those kind of things. So yeah, I mean, I started my journey early. A lot of people are like, wow, that was really early. I'm glad to have that experience. I think that really did shape who I am today and what I want to work on today.
It sounds like you have not only the response to people experience, but also the prevention and the interconnectedness
Yeah.
of the two, that background. How has your work in either of those spaces influenced your perspective as a lawmaker?
I think that influences my perspective as a lawmaker because I know where to meet survivors at, I know where to meet agencies at, and I know what the needs are still around this space. I hate to say it, but a lot of things haven't changed in the last 25 years. There's still a struggle with survivors struggling to be believed. There's still a struggle with funding. There's still a struggle with stigma and a lot of the things that we were dealing with 25 years ago, we're still dealing with today. I mean, we still don't have laws around statutes of limitations, laws to expand statute of limitations, I should say. It's still a very short window. We just made strangulation a felony in the state just a couple of years ago. So there's
And we've just closed the spousal rape loophole, a couple of years ago.
exactly, and we closed the spousal rape loophole a couple of years ago, and there's still a lot that we're struggling with. We've come a long way, but there's still a long way to go.
So there is still a long way to go. And I'd love if you could share a little bit about why, like what barriers exist to passing meaningful sexual violence legislation, and then how do you navigate them when they show up?
There's a lot of shame and stigma around sexual assault. A lot of people still think it's their fault. Try to figure out what they did wrong, which was nothing. But society is still telling them that they did something wrong, or it was how they dressed or how they acted. But really, we in this space know it's about power and control. I think with legislation, certainly there's still a lot of stigma around that. I think people are worried, do people want to game the system somehow? And again, we know that is a very rare case. So I think those are some challenges to legislation being passed and why we have such a long way to go around survivor rights and legislation that benefits survivors.
When I'm in the state house, which can be often depending on what's going on, I always try to bring a survivor or somebody with lived experience around sexual violence to the extent that we can.
Yeah.
And I've seen it be really impactful, whether it's in a one on one meeting or in a hearing or in an interested party meeting. I know that you have sat and currently sit across different committees. Are there any stories or data that are particularly impactful for you, the colleagues in your caucus, or even for your colleagues across the aisle that you've seen have a particular impact?
For me, it's a kind of again, it's a kind of a different experience because I understand the space. I know the space. It's where I got my start. I think what's interesting with my colleagues across the aisle in the majority, a lot of them respond to the economics of domestic violence, the economics of sexual assault and sexual violence. There is an economic piece around that. There's lost wages, there's
Medical expenses and
medical expenses. Sometimes you can't get to work because you're too depressed and you can't get up, but like you haven't told anybody about what happened to you because again, you're afraid someone may not believe you.
yeah.
The same goes around like anything from sexual assault to sexual harassment and that kind of thing. So there is a huge economic piece around that. And I think that's something that a lot of people respond to. They don't realize that there is lost productivity around domestic violence or sexual assault. But I do think that the stories of survivors really do hit home to a lot of people. Certainly, when I was on the phone lines, there were some cases that could be pretty rough. And the folks that I would work with and volunteer with would always make sure to check in and be like, are you okay? How was that for you? Do you need a second? So that was always appreciated. So survivors' stories can be really tough to hear sometimes. I think they're very impactful, and I think that does help impact legislation and impact people's attitudes around sexual assault and sexual violence.
For the survivors who, might be listening or might be considering going to the state house,
Yeah.
I get quite a bit of outreach, sometimes weekly, sometimes monthly, from survivors who are interested in going and testifying on a bill. But obviously, the thought of that is a little intimidating for the average person, let alone somebody who's there because the worst thing has happened to them and they'd like to make a change or see a change.
Yeah.
From your perspective, sitting on one of those committees and knowing your colleagues in the operations, is there any words of guidance that you would offer anyone who's in that position, who's thinking like, will it be impactful, will it matter, anything like that for them?
Mm-hmm. Yeah, no, that's a good question. Yes, sharing your story, giving testimony can be really difficult and daunting, but it doesn't have to be. It could be also a very inspiring thing, a very empowering thing. I would say my advice is if you feel comfortable telling your story, we'd love to hear it and have you come testify. If not, there's always written testimony. If you don't feel comfortable coming and speaking in front of a panel of 15 lawmakers right there on a dais. There's written testimony if that's a lot more comfortable for you. But if you want to tell your story, we're here to support. The majority of my colleagues are very respectful of people that come in and testify. Typically, I think around stories around survivors, my colleagues are respectful and are respectful of people's time, that they know that they take time out of their day to calm down and testify for or against a bill. They're taking time off work. They have to, take their kid to childcare or whatever. So, they know that it's important for a lot of people. If you feel comfortable doing that, I would encourage people to do so, but also know that there is an option for written testimony. And we do read those pieces of testimony in our packets.
And at OEESV, survivor storytelling has become one of the things that we're trying to move more towards and evolve and work into our programming. And I think it speaks to what you said earlier, Representative, the shame and stigma that still exists around sexual violence in the legislature, but also in our society, is largely because there's so much silence around it. So many people do not come forward. We know that rape is one of the most underreported crimes. We want people to feel like they're able to come forward and to share in whatever format is safest and most comfortable for them. So we really appreciate our colleagues in the State House and our partners in the State House who make those opportunities available and really work with survivors.
It must be pretty impactful to hear directly from people who will be affected by a piece of legislation versus it being kind of just this imaginary situation or an imaginary person, even though it is very real.
Yeah, absolutely. I'm always amazed on how many people come and testify with their personal stories because it is now public record. It is forever archived on the Ohio channel. So it's a very brave thing to do, but it's also a very impactful thing to do. And it's a very important thing, again, if you feel comfortable doing that, because not everybody does. Again, it's intimidating and people get nervous, and understandably so. But I think that it's important to hear people's stories around different pieces of legislation. I'm always very appreciative of people coming and taking the time out of their day to talk to us about legislation that we've put forward, whether it's to tell their story or to suggest changes. It is really important and impactful to do so.
If only we could have every lawmaker attend a 40-hour rape crisis training.
Right. Yeah, for sure. And again, I am grateful to have that unique position to be in, understanding the space and understanding what people are going through.
We do represent over 30 rape crisis programs throughout the state and hundreds of advocates. Are there ways that are best for them to try and partner and form a relationship with their lawmaker that you would recommend?
I think it would be important for a lot of people to kind of see what you all do on a day-to-day basis to help survivors. I think that would be very impactful and very eye-opening for a lot of people. as a young person, it certainly was very formative of my career trajectory, my life trajectory, what I decided to do career-wise. I'm thankful that someone gave a chance of an 18-year-old kid to come and volunteer with their local rape crisis center. I mean, that's what I did after school. I went down to the basement of the Appleseed Mental Health Center to listen for the phone to ring. I did that at least a couple times a week right after school. And I think that people seeing what volunteers do or what you all do on a day-to-day basis, I think would be really helpful as well. So, reach out to your lawmaker. If you don't know who that is, you can go to legislature.ohio.gov, type in your address, and it'll pop up. Very easy to find. So that's what I would suggest, just reaching out to them, seeing if they would be willing to have a conversation or come out and see what they do.
Yeah, a thought just keeps crossing my mind about how you were like a career aptitude success story. Because I remember taking those tests in school, and I wonder if I'm in the right space that was predicted for me. Did you always see yourself working in this space? I'm also curious if in the time that you've been in this field, have you had any thoughts about like a dream piece of legislation that you could pass like tomorrow? What would it be?
You mean in the space as an elected official? No. um, if you asked me 25 years ago if I would be an elected official, I would be like, you're crazy. No. But I'm glad to be where I am and to be in a role where I could make a difference for people and make a difference in our laws because, like I said before, we've come a long way, but we still have a long way to go. In terms of dream legislation, if it's like specifically for the sexual violence space, I would say expanding the statute of limitations, I think, is a big piece. I mean, it's very short. It's not very long at all. And when a lot of survivors do come forward, the statute of limitations passes and there isn't anything to be done. That hinders justice for a lot of people. And so if that was one thing that we could pass tomorrow or later today, even later today or tomorrow, that would be one of the pieces.
Anything else? Non-sexual violence related? Any big dreams?
Any big dreams? So, my biggest thing is around healthcare. So I think my dream would be to pass like kind of a single payer healthcare in the country, but there's a state bill, of course. Healthcare is a issue for everybody across this country, and healthcare is an issue for survivors.
It definitely is.
To have a single payer system where, everybody pays, there's no co-pays, there's no deductibles, that kind of thing. You can get the care you need and not have to worry about going into medical debt. I think that would be a huge life-changing thing for a lot of people.
Yeah, absolutely. It would be transformative. And like you said, so much of the issues that we see around sexual and domestic violence don't leave someone.
Right. Yes.
And they result in long-term chronic health conditions that can lead to medical debt.
Yep,
and so
for sure.
It's all related, as you like
it's
to
all
say.
Related. Yeah.
The body keeps the score.
Yeah.
Yeah. Thank you for having me on. I really appreciated the time to talk about my journey in this space. And again, I'm very grateful for the opportunity that I had with my local rape crisis center. I wouldn't trade that for anything.
Thank you to that lady with purple hair for inspiring this journey for you, because I think it's...
Yeah, Jessica.
Yeah.
Thank you, Jessica.
Thank you. I think it's important that there's someone in public office that has the experience of working in this type of work. And I like to say all roads lead to advocacy.
Yep.
So.
Yeah, they do. They do.
Thank you, Representative.
Hey, thank you.
Thanks for listening to Teal Talk. We hope you enjoyed our deep dive into intersectional issues affecting survivors in Ohio. If you like what you heard, subscribe and leave us a 5-star rating and review, recommend us to a friend, and follow us on Instagram and Facebook at OAESV and Twitter at Ohio Alliance ESV. If you'd like to learn more about us and the services we offer, sign up for our email list, or read a transcript of this episode, visit oaesv.org.
Want to share a comment or ask a question for a future episode? Just click on the link in the show notes to leave us a voicemail. And remember, we're here to help. Feel free to call our resource line at 888-886-8388 during regular business hours, or the Ohio Sexual Violence Helpline 24/7 at 844-644-6435. See you next time.